intraoral air pressures for obstruent consonants and facilitates oral resonance. Normal speech uses the lips and tongue to constrict or valve off the airflow. These constrictions occur in various places within the oral cavity to produce different consonants. Individuals with cleft palate or with repaired but insufficient closure mechanisms cannot achieve oral airflow, adequate oral pressures, or predominantly oral resonance. They have no choice but to speak with nasally directed airflow that causes nasal emission, and with inadequate oral pressures and excessive nasal resonance. At the outset, the baby with a cleft palate is confronted with the task of early speech learning in the context of abnormal anatomy and physiology. Etiologically, two categories of misarticulations can be defined. Category 1 includes misarticulations that are structurally based and are obligatory. They are caused by velopharyngeal insufficiency due to unoperated palatal clefts or functionally insufficient tissue postoperatively, and by oronasal fistulae. In general, these misarticulations include weak oral pressures and nasal emission distortions of the high-pressure consonants, the stops, fricatives, and affricates. Category 1 misarticulations can be eliminated by successful physical management. Category 2 includes misarticulations that are the result of speech mislearning. They are eliminated or modified, not through physical management, but with speech therapy. It is this second category of misarticulations that is the focus of this presentation. Category 2 misarticulations often are viewed as compensatory in nature. In general, these misarticulations all are associated with maladaptive placements. The literature repeatedly describes compensatory productions as backed articulations with respect to normal oral placements. They are learned strategies that initially serve to accommodate speech pressure valving demands in the presence of an open velopharyngeal port and absent bony palate partition. Not all cleft palate speakers develop such compensatory strategies. For those who do, however, compensatory articulations often persist, even after adequate velopharyngeal function has been achieved through surgery or appliance management. Like the normal consonants of English, these compensatory productions are unvoiced or voiced and require a special set of symbols for phonetic transcription. Compensatory articulations include the glottal stop, the pharyngeal stop, the pharyngeal fricative, the pharyngeal affricate, the velar fricative, the mid-dorsum palatal stop, and the posterior nasal fricative. Note that the glottal stop is only voiced. The posterior nasal fricative is an unvoiced production. Compensatory articulations can be described by individually characteristic gestures of the tongue, pharynx, or larynx, and each has a distinctive perceptual pattern. In addition, the following scenes include brief phonetic transcription training for compensatory articulations and information on their substitution patterns. In most of the illustrations that you are about to see, the soft palate is not engaged in velopharyngeal closure. It is shown in the rest position so that you can focus on the deviant contacts and postures of the tongue, pharynx, and larynx. The glottal stop is a stop consonant made in the glottal place of production. The articulatory gesture uses vocal fold valving. It is commonly substituted for the whole class of stops. It can also replace affricates ch and j, and less commonly, fricatives. It is perceptually distinct from oral stop productions and from omission. Listen to the production contrasts between normal stop, glottal stop substitution, and omitted stop in the words hat, key, and boy.
Hat, hat, ha, hat, ha, ha, key, e, e, key, e, e, boy, oi, oi, boy, oi, oi.
Listen now to a child who has a repaired bilateral complete cleft lip and palate, and who uses glottal stops.
Not eating milk. Not eating milk.
Often, the glottal stop is produced as a co-articulated stop. In this context, the term co-articulation denotes a maladaptive gesture characterized by one manner of production, in this instance stop, with simultaneous valving at two places of production. The deviant place is the effective one for manner. In this example of co-articulated T and glottal stop, the two places are tip alveolar and glottal.
For example, the normal production of toy becomes toy. Listen to this a few more times. Toy, 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 toy.
Now listen to an adult speaker producing co-articulated glottal stops.
Most boys like to play football. Most boys like to play football. Do you want to take my new camp? Do you want to take my new camp?
The pharyngeal stop is made with a lingua-pharyngeal articulatory gesture. The point of stop contact is between the tongue base and the posterior pharyngeal wall. The lingual dorsum is convex. The stop contact gesture may occur higher or lower in the pharynx. In isolation, the pharyngeal stop sounds like this. And this.
Ga, ga, ga.
It is used as a substitution for K and G. The pharyngeal stop does not occur as a co-articulation. Listen to these next word productions in which normal K and G articulations are replaced by unvoiced and voiced pharyngeal stops in both pre- and post-vocalic positions.
Key, 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 key. Duck, 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 duck. Go, 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 go. Hug, 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 hug.
Listen to these production contrasts again and note that increased muscular activity in the lower neck accompanies pharyngeal stop productions.
Key, 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 key. Duck, 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 duck. Go, 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 go. Hug, 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 hug.
Perceptually, the pharyngeal stop is distinct from K, G, and glottal stop. Now listen to these next productions to distinguish normal versus pharyngeal versus glottal stop productions.
Key, P, E, key, P, E, duck, 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 duck.
Listen for the increased duration of consonant-vowel transitions in pharyngeal stop articulations.
Go, go, oh, go, oh, oh, hug, 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 hug. Bigger, bigger, bitter, bigger, bigger, bitter.
Now listen to a child speaker using pharyngeal stops in sentence productions.
Mommy hot the mall. Mommy hot the mall. Cut the hole with a pair of scissors. Cut the hole with a pair of scissors.
The pharyngeal fricative is a lingua-pharyngeal fricative gesture. Its point of constriction is similar to the pharyngeal stop. However, the tongue does not contact the posterior pharyngeal wall. Also, the lingual dorsum is more concave or flattened from its base to apex. Like the pharyngeal stop, the point of constriction may be higher or lower in the pharynx. In isolation, it sounds like this and this. The pharyngeal fricative is substituted for sibilant fricatives and affricates. It also occurs as a compensatory co-articulation with sibilant fricatives. It is perceptually distinct from the normal oral sibilant fricatives and affricates, which are linguo-alveolar and linguo-palatal in place of production. Clinicians sometimes confuse the pharyngeal fricative with the lateralized sibilant production. Like the pharyngeal stop, the pharyngeal fricative production has associated excessive muscular activity in the lower neck. This is easily seen in these contrasts between normal S and unvoiced pharyngeal fricative productions. Listen now to two patients with repaired cleft palates who use pharyngeal fricatives.
Please watch the door. Please watch the door. I can't hear the car bumper. I can't hear the car bumper. Most boys like to play football. Most boys like to play football. We shouldn't play in the street. We shouldn't play in the street. Tom has ham and eggs for breakfast. Tom has ham and eggs for breakfast.
Kawano and colleagues described what they have termed laryngeal fricative in the speech of 5 patients. As shown here, associated articulatory gestures include a point of constriction between epiglottis and posterior wall, with the simultaneous upward and forward movement of the arytenoid cartilages towards the epiglottis. These gestures may in fact be components or variants of the pharyngeal fricative. The pharyngeal affricate is made with simultaneous glottal and linguopharyngeal valving. It is a compensatory version of the oral affricates and combines glottal stop with pharyngeal fricative. It can be voiced or unvoiced. It is used as a substitution for oral affricates ch and j and does not occur as a coarticulation. It is perceptually distinct from pharyngeal fricative, glottal stop, and pharyngeal stop. Listen to these differences now in CV production contrast using the vowel O.
Ho. 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 O. Ho. O. Ho. O. Ho. 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 Ho.
Listen now as a child speaker produces pharyngeal affricates in single words.
Chair. Net. Watch. Engine. Watch. Cage.
Now listen to these sentences.
Daddy, my atlas. Daddy, my atlas. How ice cream is good. How ice cream is good.
The velar fricative is a fricative production made in back velar place of articulation. The articulatory gesture is similar to the normal K or G. The tongue approximates, but does not contact the palate. In isolation, the velar fricative sounds like this and this. The velar fricative is commonly heard in dysarthria, where it occurs because of reduced range of movement in the back tongue. In cleft palate speech, it occurs as a backed substitution for sibilant fricatives. It can also occur as a distortion of K and G when there is a loss of stop quality because of velopharyngeal port leak. The velar fricative is easily distinguished from the oral sibilant fricatives S and Z and the velar stops. The mid-dorsum palatal stop is a stop consonant made in the approximate place of the glide y. In isolation, it sounds like this and this.
Yeah. Yeah.
The unvoiced production is used as a substitution for T and K. The voiced production occurs as a substitution for D or G. Perceptually, the mid-dorsum palatal stop sounds like a cross between TK or DG. For example, the target words cop and top will be indistinguishable if either initial sound is substituted by the mid-dorsum palatal gesture. Listen to these productions.
Cop, top, chop, cop, top, chop, cop, top, chop.
The mid-dorsum palatal stop may represent a place compromise. That is, in attempting to valve airflow for anterior and posterior stops, the tongue valves into the cleft, or perhaps fistula, located between the two places. Listen now to a speaker with a repaired cleft palate producing mid-dorsum palatal stops for T and D.
Please rest the dog. Please rest the dog. I hear white cat. I hear white cat. Please where's the kisses? Please where's the kisses?
The posterior nasal fricative is an unvoiced frication that shows variability in articulatory gestures. Radiographically and with nasendoscopy, it appears as an incomplete velum to posterior pharyngeal wall contact. Often there is blurring of the image, suggestive of velar flutter frication. In structurally intact but functionally inadequate palates, the posterior nasal fricative may represent a lingual assist posturing, as the tongue attempts to help the soft palate to closure. It is perceptually distinct from nasal air emission and velar or pharyngeal fricatives because of audible nasal turbulence or snorting. In isolation, the posterior nasal fricative sounds like this. The posterior nasal fricative occurs as a co-articulation for any or all of the high-pressure consonants.
For example, soap becomes soap. Top becomes top. Listen to these again. Soap becomes soap. Top becomes top.
This gesture is used as a substitution for sibilant fricatives and affricates. Often, the posterior nasal fricative is the only perceptual indicator of phone-specific velopharyngeal inadequacy. Posterior nasal fricatives are heard in the speech of this youngster who has an unoperated submucous cleft palate.
I feel my cat. I feel my cat. I'm comfortable. I'm comfortable. Comfortable with a pair of scissors. Comfortable with a pair of scissors.
We have seen that cleft palate speakers can learn and use a variety of compensatory strategies in order to satisfy speech pressure valving demands. As presented, at least 7 articulatory types and 15 perceptually distinct forms have been documented, 8 voiced and 7 unvoiced productions. When these compensations coexist with velopharyngeal insufficiency, physical management must precede any successful speech therapy. Hopefully, the description of compensatory articulations and transcription system illustrated in this presentation will help clinicians to better diagnose, document, and provide or recommend appropriate treatment for compensatory articulations in cleft palate individuals.